Hello interpreter, and welcome to the 10-minute briefing of the 2026 VNS Health and CMS Annual Audit. During the next 10 minutes we'll review the following content. We will cover information about the main topic, VNS, and also CMS, the star rating system, how to prepare for the VNS audit calls, how to use a checklist, what the content and format of the call will be, and also the Part C and Part D questions. We will also show you a sample call, to give you a better idea of what these calls sound like, and some tips and recommendations. Hey, let's dive in. VNS Health is a non-profit organization that provides home and community-based healthcare in the New York City area. They offer a variety of services, including health plans, home care, and hospice care. Stands for Centers for Medicare and Medicaid Services, a federal agency that provides health insurance. CMS manages the Medicare, Medicaid, the Children's Health Insurance Program, and the health insurance marketplace. The Centers for Medicare and Medicaid Services, also called CMS, star rating system is a 5-star rating system that compares the quality of health plans, hospitals, and nursing homes. The ratings help consumers, families, and caregivers make informed decisions about their health care. The health plans are rated on a scale of 1 to 5 stars, with 5 being the highest. The rating is based on 3 categories: medical care, member experience, and plan administration. The STARS rating system is used in the call center environment to evaluate a center's timeliness, accuracy, and accessibility. Customers that utilize OPI to assist their patients must take part in these test calls that pertain to accuracy and accessibility. The test calls are conducted by secret shoppers, and they are meant to measure interpreter availability and accuracy of interpretation. Again, keep in mind that the secret shoppers use a script. The VNS agents also use a script. And you, the interpreter, have those scripts. What does it mean? Well, what it means is that everything is scripted. Remember this, the question will always be, are you the right person to answer questions about VNS Health? This question will never ever change. Let's recap. All audit calls start with the LEP asking the following question. Are you the right person to answer questions about VNS Health? For this year, calls will start coming on February 1st, 26. Please remember that you must interpret this question into English for the agent. And also remember that there's no need to add any greeting or questions of your own. Do not add anything to the call that it is not said by the agent or secret shopper. After the agent answers yes, the LEP will ask a series of 3 questions. These questions are pulled from the list provided during the VNS Health training module, available for you to take. For instance, do you have a summary of your plan benefits on your website? As I just mentioned, the VNS Health training module is available for you to take. Even if you took the training last year, you must take it again, since some drugs, prices, and plan have changed. Now, let's talk about how to prepare for the Please ensure your space is soundproof to minimize distractions during calls, enhancing focus and communication quality. Look at this picture. Do you see what is wrong with it? It seems like the obvious, but we thought an image could illustrate this point better, in a way. Now, make sure that you are working from an area that is quiet and free of distractions, and that you never use communal spaces to take calls. It is very important to have everything you need ready, like a pen or pencil, a notepad, and a glass of water. In case you are wondering about the scripts, there are some documents that you need to have in front of you at all times. Like the Part C and Part D questions, and the one-pager we sent you via email. It should go without saying, but it is extremely important that you refrain from eating during a call. Always use the area that is in your house with office-like furniture. Once again, please remember that every call will start with a question, the same question. And rest assured that these are the only possible opening questions. Hello, are you the right person to answer questions about VNS Health Easy Care HMO? Or, are you the right person to answer questions about VNS Health Easy Care plus HMO DSNP? Or, Are you the right person to answer questions about VNS Health Total HMO DSNP? Or, are you the right person to answer questions about VNS Health MLTC? Or, are you the right person to answer questions about VNS Select Health? It is important for you to know that receives a passing score only if an interpreter is successfully connected and helps get a series of several questions answered accurately within 8 minutes, including the time spent getting the interpreter on the line. Yes. 8 minutes. After the 8th minute, the secret shopper will say something along the lines of, "The time for this audit has reached the limit," and disconnect the call. If during the audit call the interpreter used too long pauses, mumbled, or hesitated before renditions, or had false starts, or missed the first question, or mispronounced the name of a plan, or did not provide a verbatim interpretation of the questions and answers, the call will not receive a passing rate. Remember, all is scripted, you just have to review it. Take the training module in OWL. After the secret shopper asks, "Are you the right person to answer questions about VNS Health?" and he says the name of the plan, you should immediately interpret the question and continue with your interpretation as quickly and accurately as possible. Keep in mind that only 3 questions will be asked. The other 2 questions will be about Part C and/or Part D. Cut out formalities during opening and closing of the call. Do not sacrifice accuracy or completeness. Do not add any words or greetings unless uttered by the parties. Everything is scripted. There are no surprises. All parties are following the same script. Interpreters are expected to know the plan names, drug names, amounts, and service areas for VNS in New York. These are some of the drugs that can be mentioned during any test call. Sometimes no drugs are mentioned at all. Crazati, Capaxone, YFAX, Wegovy, Vyleesi, Arexvy, Viricept, Latisse, Shingrix. If you have worked for this period in the past, notice that the following amounts changed from 2025 to 2026. The maximum out-of-pocket in 2025 is $9,250. The monthly premium is $25 if the member has no extra help. The copayment for the emergency room is $115 and will not be waived. Notice that the service areas in the state of New York have expanded too. These are the current ones: Albany, Bronx, Dutchess, Erie, Kings, Brooklyn, Monroe, Nassau, New York, Manhattan, Niagara, Onondaga, Orange, Queens, Rensselaer, Richmond, Staten Island, Rockland, Saratoga, Schenectady, Suffolk, Sullivan, Westchester. This is an example of the questions asked during a test call. All this material has been already sent you via email. Please check your email and contact LB if you have not received the emails. Now it's time to listen to a call. This is the format and way VNS audit calls sound like. After listening to the call, please complete the training in OWL if you have not done so yet. Please complete the OWL training and check your email for Lionbridge news and updates on the 2026 VNS audit period.
Good afternoon. Thank you for calling VNS Health. My name is Martha. Who do I have the pleasure of speaking to?
Buenas tardes, gracias por llamar a VNS Health. Mi nombre es Marta, con quien tengo el placer de hablar.
Hola, soy Gina. Buenas tardes. ¿Es usted la persona adecuada para responder preguntas sobre los beneficios del plan HMO de VNS Health Easy Care?
Hello, good afternoon. I'm Gina. Are you the right person to answer questions about VNS Health Easy Care HMO plan benefits?
Yes, I am. How can I help you?
Sí, yo soy. ¿Cómo la puedo ayudar?
¿Cuál es la prima consolidada mensual para el plan VNS Health Easy Care HMO?
What is the monthly consolidated premium for VNS Health Easy Care HMO?
The monthly premium for this plan is $25. Depending on your level of extra help, the monthly premium may be less.
La prima mensual para este plan es de $25. Dependiendo de su nivel de ayuda adicional, la prima mensual puede ser menor.
¿Puede mi mamá usar su seguro complementario de Medicare para pagar los costos de bolsillo del plan Medicare Advantage como los copagos?
Can my mom use her Medicare supplement insurance to pay for Medicare Advantage plans out-of-pocket cost, like copays?
No, a beneficiary may not be enrolled in both a Medicare supplement and a Medicare Advantage plan at the same time.
No, un beneficiario no puede estar inscrito en un plan suplementario de Medicare y en un plan Medicare Advantage al mismo tiempo.
Mi mamá vive en el condado de Albany. ¿Puede inscribirse en su plan?
My mom lives in Albany County. Can she enroll in your plan?
Service area includes Albany County.
El área de servicio incluye el condado de Albany.
Gracias.
Thank you.
Thanks.
This is the format all these calls follow. They do not deviate from it. Once again, please complete the OWL training and check your email for Lionbridge news and updates on the 2026 VNS audit period. Now, let's recap all we have covered and remember these useful tips. Learn the opening question by heart. Memorize the 5 plan names. Familiarize with the drug names. Familiarize with the 13 areas of service. Part C contains 20 questions about general matters. Read them, verbalize them, practice. Part D contains 24 questions about drug coverage. Read them, verbalize them, practice. Cut out formalities during opening and closing of the call. Do not add any words or greetings to the script. All parties are following the same script.